Today, we're diving into an essential guide on one of the most common antidepressants out there, sertraline. We're going to break down exactly what it is, how it actually works in your brain, and most importantly, everything you need to know to approach it safely. So here's what we've got on tap. We'll start with the basics of what sertraline is. Then we'll get into the science of how it works. After that, the practical stuff, taking it, what to expect. We'll also cover side effects, both common and serious. And we'll wrap up with some really key cautions. Ready? Let's go. All right, let's kick things off with the big question. What exactly is sertraline? Let's get to the fundamentals of this medication you hear so much about. Okay, so sertraline is part of a family of drugs called SSRIs. That stands for Selective Serotonin Reuptake Inhibitors. Yeah, it's a mouthful, but we're going to break down what that means in just a minute. The big thing to know right off the bat is that you can't just pick this up at the pharmacy. You absolutely need a doctor's prescription. And it's not just prescribed for depression. While that's definitely its main use, doctors also find it really helpful for treating other conditions like post-traumatic stress disorder. You've probably heard of it as PTSD, and also Obsessive Compulsive Disorder, or OCD. So, the million-dollar question, how does sertraline actually do its job inside our brains? Well, it all boils down to a chemical messenger that gets this great nickname, the feel-good chemical. And that feel-good chemical is called serotonin. You can think of it as one of the brain's main mood regulators. When your serotonin levels dip too low, your mood can follow suit. And that's the very imbalance that sertraline is designed to help correct. Here's a simple breakdown of how that works. In your brain, serotonin's job is to deliver signals between nerve cells. After the message is sent, it normally gets reabsorbed. That process is called reuptake. What sertraline does is pretty clever. It basically steps in and blocks that reuptake. So what happens? More serotonin is left hanging around in the brain, which can help lift and stabilize your mood over time. Okay, so we've covered the what and the how. Now let's get into the nitty-gritty, the practical side of things. What should you expect when you actually start taking sertraline? Now, this is a time frame you really, really need to keep in mind. It's not an instant fix. While you might start to feel some small improvements earlier, it generally takes a full 4 to 6 weeks for the medication to build up and reach its full, most effective level. So a little bit of patience is definitely required in those first few weeks. When it comes to dosage, it often varies by age. For adults and teenagers, a pretty standard starting dose is 50 milligrams a day. For younger kids, it's usually about half that. But, and this is super important, your doctor is in the driver's seat. They'll figure out the exact right dose for you, maybe starting you off even lower and then slowly increasing it up to a maximum of 200 milligrams if needed. Consistency here is everything. It's a once-a-day thing, and it's a really good idea to take it around the same time each day. Oh, and a great little tip, if you find it's messing with your sleep, just try taking it in the morning instead. And hey, if you ever forget a dose, don't panic. Just skip the one you missed and take your next dose as usual. Whatever you do, don't double up to catch up. Okay, I can't stress this enough. This is so, so important. Even if you're feeling a million times better, you should never just stop taking sertraline cold turkey. If you do, your symptoms can come rushing back. When it's time to stop, your doctor will walk you through how to slowly lower the dose over several weeks to come off it safely. Now, just like any other medication, sertraline can come with side effects. So let's talk about what's pretty common versus what's more serious, so you know exactly what to look out for. It really helps to put these side effects in perspective. The common ones, well, they happen to more than 1 out of every 100 people, and they're typically mild and tend to go away on their own. Serious side effects, on the other hand, are much, much rarer. But if they do happen, they're a clear signal that you need to get medical help right away. So what kind of common things might you feel? Well, maybe a bit of nausea, some headaches, maybe feeling tired. The most important thing to know is that these usually pop up right at the beginning and then fade away as your body gets used to the medication. So that brings us to a really critical question. What are the red flags? What are the warning signs that mean you need to get in touch with a doctor immediately? These are the rare but serious signs you have to watch for. We're talking about things like your skin or eyes turning yellow, any unusual bleeding or bruising, or even extreme mood swings like feeling overwhelmingly happy or restless. These are not things to wait out. They mean you should call your doctor right away. And sure, other side effects can happen too, like changes in your weight or a lower sex drive. The big takeaway here is to just keep the lines of communication open.
Any concern you have, no matter how small it seems, is worth bringing up with your doctor so you can manage it together. All right, finally, let's cover safety. Sertraline doesn't exist in a bubble, right? So it's super important to think about your other health conditions and any other medicines you might be taking.
Being a completely open book with your doctor is non-negotiable. It is vital that they know if you have any of these conditions, things like heart problems, epilepsy, or if you're pregnant or planning to be. This is how they can be sure that sertraline is a safe and appropriate choice for you. And it's also absolutely critical to tell your doctor about every other medication you're taking. Sertraline can interact with certain drugs, especially ones that affect your heartbeat. It can even interact with other antidepressants you might have taken in the past. This information helps your doctor prevent any potentially dangerous combinations. So, as we wrap this up, I want to leave you with this idea. A prescription isn't just a pill. It's one piece of a much larger health plan. And all this information is meant to empower you, to help you be an active, informed partner in your own treatment. So the real question is, how will you team up with your doctor to navigate your own health journey?